I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over how to foam roll the legs. So we get a lot of people who come in here as runners, who come in here with just a lot of compensation issues. And we're not going to go into compensation issues tonight because that's not what this particular video is about. But we wind up with a lot of people who want to do things outside of here. We don't want to chain you here for the rest of your life. That's not what physical therapy is about. We want to teach you strategies that you can use outside of here to actually help you achieve your goals, get better, get yourself out of pain. So the one major thing that we do teach in here is foam rolling. And this is good for back pain, knee pain, hip pain, I mean, you name it. We really give this out quite a bit to all of our patients and go through a pretty extensive foam rolling program with them. So you're able to do things at home. And this is one of the things that you can do every day at home to actually make yourself feel better. Warning, in the beginning, you're not going to feel great. It's probably going to hurt. And a lot of people that come in here have foam rollers that they've purchased in the past, and they're sitting there collecting nuts, much like treadmills, because they went to foam roll and it hurt a lot. So it's not okay to stop. You want to do some modifications to make it hurt less. But I promise you, as you do it more, it's going to hurt less, and it's also going to become to a point where you feel like you need it. So a lot of people have gotten to the stage now where if they don't foam roll, they actually crave it. And you do, believe it or not, get to that point. So tonight we're going to go through how to foam roll your legs. There's a lot more to foam rolling than what we're going to show you tonight. We do have a very extensive program that we do go through with people. But for tonight, I'm going to show you how to do foam rolling with your leg. So tonight I'm holding Spike, our rumble roller. So everyone always asks me about foam rollers. If you go to our YouTube channel, we do have an entire video on differences in foam rollers. I will give you kind of a short synopsis. This is the best one going for breaking up knots. Yes, there are some ridges, ones with ridges, there are some with raises, there are some flat ones, yada, yada, yada. I recommend having two. One that looks like this with spikes. Not ridges, not raises, spikes. And one that's completely flat. I recommend the flat one because you can't always tolerate this. If you have an injury, if you're sore, if you're just starting out, this is extremely aggressive. And you'll do this once, you will get bruised. I can almost promise you that. And you won't do it again. Having spike and a flat roller you'll be able to switch it out. So if there's a exercise that I'm showing you tonight that you can't tolerate with spike, then go to the flat roller. It's okay to use these interchangeably. What's not okay is not to do it just because it's just so painful. There's a lot of misconceptions out there on the internet on what you can and can't do with foam rolling. I mean, imagine that. Yeah, the internet's not always right. You can roll this over your joints. You don't need to necessarily concentrate on it. It's not going to hurt it. And as I'm going to show you, we're going to go up into some postures today. Then we're going to go right over the joints, right over the bones. And it's okay. You don't want to sit there and needle the joints or the bones, because what are you rubbing out at that point? But you know, it's okay to rub this. When you get done with this on your legs, it should have touched every part of your leg. So if you haven't, then there's an issue. So we're going to start on we're just going to sit on the roller, and all you're going to do is you just roll back and forth. You want to go from the top of your back all the way to the bottom of your glutes. Now, when it comes to foam rolling, you want to do it about 10 minutes a day. You can break this up into 1-minute segments during the day. You can break this up into 30-second segments. But again, you want to make sure it touches every part, all right? And you're doing it for about 10 minutes. So this one's a pretty easy one. You're just going to roll back and forth up to your low back, all the way down to the bottom of your glutes. You may or may not feel a tender point. You may not feel a point of pain. That's okay. Even if you don't, still do a couple rolls on this. Then you're going to cross your ankle over your knee, and you're going to lean to the side that is crossed. And you're going to do the same thing. We're going to go from the low back all the way down to the bottom of the glutes. Now, you might start feeling some pain points with this. Like you might run over a particular spot, and it might be really sore. You want to stop on that spot. And you want to hold it for, 10, 15 seconds. And then you want to move on. Now, word to the wise, a lot of times some of these muscles will have 15, 20 spots as you're rolling along. You're like, oh, there's a spot. Pick like 2 or 3 to hit in one night and then move on. Do not try and hit all 50 spots in one night. You'll wind up actually making yourself really sore. So again, you're just going to hold it on that spot, and then you're going to just keep moving along. And then you switch sides, do the same thing, lean to the side that's crossed, and go back and forth. If you find that you're finding a bunch of spots here, stay here for about a minute, concentrating on 2 or 3 spots and then just rolling the whole muscle. Then you're going to go to your hamstrings. And you're going to see me move the foam roller because I'm trying to stay in the view of the camera. When you foam roll, you're going to foam roll all the way up and down your floor. So you're going to wind up in a spot far from where you started. That means you're doing it correctly. So hamstrings, all you're going to do is go from your glutes all the way to the back of your knee. Okay? What you can do is, if you don't feel anything with this, is you can cross one leg over the other. And you can go and roll it that way. If this is too intense, do it this way. If that's too intense, then get a flat roller. Again, you want to make sure that you are concentrating, well, not concentrating, but make sure you're going behind your knee too, all right? Don't stop here right above your knee and then start right below your knee. Make sure you get in the back of your knee too, where everything comes in and inserts and attaches. A lot of times that's a very painful spot for people that you do want to take into account and make sure you roll. If lifting your arms or lifting your butt off the floor with your arms is too much and it's too painful, then just sit down, okay? And a lot of people can just straighten out their legs and you get a really good roll in the back of your knees just by doing this. You will get an ab and an arm workout when you do this. This can be very tiresome on your upper body and your core. So don't stop just because you're fatigued, because your shoulders are tired or your abs are tired. That means you're doing it correctly. If you need to take frequent breaks, that's okay too. Here's a couple of variations that we're going to show you when it comes to the back of the legs, the back of the calves here. So the first one is you're just going to sit here. I'm not lifting up. I'm not doing anything. A lot of times, especially if your calves are sore and you are using a spike roller, this is enough. You're just going to go back and forth, nice and slow. All right, and let the spikes go in. The second option is just to lift your butt up and go back and forth. Again, nice and slow. You're going to go up to the back of the knees, okay? And then just pull your butt through nice and slow. The final option is, same with the hamstrings, is you're going to cross one leg over and then push your butt off the table and roll all the way down. You want to roll down to your ankle, okay? And then all the way up to the back of your knee. And then you're going to go onto your side. So now you're going to work on your IT band. So a lot of people like to cheat when they do this, and they like to stay like this. This is not your IT band. You're back to doing your glutes and your piriformis like you were before. So you want to completely position yourself on your side, okay? This is the easiest way. You're going to have your arms pushing down. You're going to have your foot pushing up. It's going to take the pressure off of this leg so there's not so much bearing down as you go forward, okay? But if this is too easy, then you can take the amount of pressure you lift up, and actually bear a lot of weight down. When you get really good, you can stack your feet and do it. Now, I'm going to go out of camera if I do the whole thing, so I'm just going to scoot this down. But you're going to go from your hip all the way down to your knee. So here's your IT band. This one can be extremely painful with this type of roller, especially if you've never done it before. It may take some working up to. Don't quit. You will probably bruise, and that's okay. If you bruise, don't hit it as hard the next day, but just keep working at it, and it will get better. You're then going to go down to the bottom of your feet or the bottom of your legs and go from your ankle up to your knee. All right, so just like this, nice and easy. Then you're going to flip onto your stomach. Okay, so we're going to get the front. We're going to get our quads. We're going to get our hip flexors. You want to come all the way up to your hips. Okay, go down to your quads. Down there, okay? Nice and easy. And then what you're going to do is you're going to come up onto your shins and do the front of your shins. And go all the way down to your ankles. Now, if that's too painful, you suffer from shin splints, you can take one leg off and just do one leg at a time. Nice and easy. just like this. The final one we're going to go through, which is the most awkward one for people to get into, you're going to have the roller lay in line with your body, and you're just going to drape your leg over, and then you're going to roll it out nice and easy. So you're rolling the inside of your leg. This one, again, takes a little bit of getting used to. You want to make sure that your knee is bent up to about 90 degrees. That'll help you be able to roll, there's a good spot, across the roller nice and easy. Again, 10 minutes. Spend as much time as you like on each area. 10 minutes is just kind of a gauge. A lot of people need to work up to 10 minutes, so you do a minute at a time here and there. I recommend incorporating this into your daily life, so it's not a 10-minute, oh my gosh, I have to go foam roll. If you're making dinner, sit down, do your piriformis, your butt muscle, do your hamstrings, do your quads. If you're sitting on a conference call, have one of these in your office, so you're able to sit on it and just roll out. The more you do this during the day, the more you are going to break up the knots.